My name is Emily Arker, and I'm a school psychologist in MCPS.
Hi, my name is Dr. Tammy Smith, and I'm also a school psychologist with Montgomery County Public Schools. And we are very excited to have you join us for our presentation. We're going to talk to you today about self-care and coping skills. This presentation is meant for parents and caregivers, and the skills that we talk about are things that could be used at any time, but particularly during the COVID-19 shutdown.
We do also have Janice Campbell here with us today. She's helping us with the recording, so thank you very much, Janice. Our objectives for today are that participants will be able to define self-care, define coping skills, explain the importance of self-care and coping skills, and identify at least 2 strategies that you can use during the COVID-19 school building closure.
People wonder what self-care actually is, and it's actually taking care of yourself and your needs. So in order for self-care to really be meaningful, it has to be practices, just regular practices that, when made into habits, help to build emotional and psychological resilience, and it increases and supports the quality of everyday life.
Why is self-care important? Well, right now it's especially important because during COVID-19, we're not able to access the things that we typically are able to do for self-care. So a personal example is that I typically go to a gym, but I haven't been going over the last few months. Or my family would generally go on a beach vacation over the summer, which we also weren't able to do. So we need to find new and different ways during COVID-19 to engage in self-care. Self-care is important because it helps meet our own needs in staying healthy, maintaining our energy and patience, and allowing us to better help others. Another difference right now during COVID-19 is that we're seeing our immediate family a lot more than usual. I know for myself, my kids are home and I'm helping them with their distance learning every day, and I'm not getting that break that I typically get when they're in school or going to soccer practice or something like that. And at the same point, we're not seeing our other support systems as much as we typically do.
I want to demystify something, and something that I hear a lot, and I used to think myself, which is that self-care is being selfish. Many of us are raised to put others' needs before our own, and when people take care of themselves, that meant that they were being selfish, but it actually is not selfish. When you take your car into the shop for maintenance, for example, think of yourself and your body as a car. You keep it in good repair, then you can really rely on it. Without maintaining it, the car is going to have a lot of issues, and what you end up doing is reacting after the fact. So is this what you want? Instead of the car being in good repair, you don't want to be in a situation where you're reacting after things fall apart. Coping skills are really essential to self-care. And what it means to cope is how we handle a variety of situations. It's how we face and deal with everyday events and interactions. They can be just the small kind of typical interactions we have with people, and how we feel when those interactions occur, how we react to them. It's how we even manage during difficult times or with difficult people, difficult situations, or things that are unexpected. How effective we are at solving problems. And again, big problems, small problems, it's how we react to what happens to us. And also facing our fears and our apprehensions. Coping skills are really, really important. They're really critical to the quality of life. They help us relate comfortably to others. They help us set personal boundaries so that we can maintain what's okay and what's not okay and how we interact with others, and also our ability to respect the boundaries of others. Good coping really protects us from burnout, from becoming too stressed out. We can minimize the need to engage in what's called fight or flight response because we're able to sort of stay in the moment. To cope well, it helps us to establish a positive outlook on life, and it is essential for resilience. And resilience is the ability to bounce back when there's adversity or trauma that occurs in our lives.
Self-care and coping are related. Self-care is essential for coping with life stressors, pressures, traumas, and catastrophes. Self-care builds our reserves and our resilience so that we can cope with the challenges of everyday life. There are 5 areas of self-care and coping that we'll be discussing today. These areas are physical, social, intellectual, spiritual, and emotional. The first area that we'll go over today is physical self-care, and we have these broken into both quick fix and long-term. Quick fix means it's something that you can implement immediately, and long-term is something where you can establish a practice where day after day or week after week, it's something that you're doing to make sure that you're engaging in that type of self-care. So for physical quick fix, we have taking a 10-minute walk, and that can be, depending on your own schedule, before you get your kids signed in for their online school in the morning, during your lunch break, once their online school ends for the day. If you have more time, fantastic, but even that 10 minutes will make a big difference. Taking deep breaths, and even while we're home, taking advantage of taking a nice long shower or a nice long bath within your home. Long-term, some ideas include participating in an exercise program you enjoy. So for example, maybe that's a socially distanced running club where you're running 6 feet apart from the others. Finding a friend in the neighborhood that you can go for a walk with 6 feet apart. An online mindfulness group, or practicing yoga either in the home or outside of the home. And we also want to make sure that we're all going for our regular physicals with our doctors to make sure that we're still staying on top of those things that we need to do to make sure we're taking care of our physical needs. Social self-care. Some things that you could do immediately are call or text a family member or a friend that you haven't seen in a while. And with social media, there's Facebook and so many other ways to stay in touch with our friends and our loved ones. Having a good laugh with somebody is also very important and really fills our cup for feeling good about ourselves and our connection with others. Long term, we can build in regular date nights. So that can even be staying in your home, getting takeout, watching Netflix, but having that regular time that you build in to do something special with your partner. And with friends, you could do something like a regular online game night on Saturday nights where there's a certain game that you play virtually to just stay connected to your social group. And having relationships at work is important too. Investing that time, if it is over Zoom, Google Meets, whatever platform it is that you use, just connecting with your coworkers over all the things that are happening right now. Personally, I feel like my connection with some of my coworkers has really grown because we've all experienced this together. Intellectual self-care. Some things that you could do today include doing a crossword puzzle, a memory game, looking up a new word. And they have these great online virtual museum and art gallery visits now, which are fantastic. So that would be something that if there's a museum that is in Paris that you've always wanted to see, then you can go ahead and check it out and cross that off your bucket list. So that's really neat. And long-term, finding a career path you enjoy, volunteering, taking an online class, joining an online book club, taking up a hobby that maybe you loved doing something when you were younger, didn't have the time for it, maybe picking that back up now, reading about your culture and other people's cultures, and taking the time to think of new routines that will help you to be more effective and efficient in meeting your goals.
I'm going to talk about spiritual and emotional self-care, but I want to point out that a lot of the activities that we recommend really cross over in a lot of different domains. So when we talk about spiritual, for example, you can engage in meditation and positive visualizations, and that can help you emotionally, physically, spiritually. When you engage in long-term practices such as mindfulness, mindfulness again can involve multiple parts of your life and your body and yourself. And so you can commit to one thing and take care of a lot of needs at one time. But what's important is that you make a commitment to something like being involved in a place of worship. Just committing to spiritually fulfilling activities that are meaningful to you. So doing things in your life that add meaning, and emotional self-care, which is really the cornerstone for all of us to function on a day-to-day basis. There's something called the emotional quotient. Rather than the IQ, it's the EQ. And it's how we can function emotionally in the world. So things that can help us with that, things that I use in particular, I have a number of greeting cards that I've collected over the years, actually over the decades. And there are times where I will just reflect, just go through them and reflect and look at the really positive messages and kind things that people may have said about me and to me, thank you notes and things, and it really re-energizes, on those more stressful days. So that's something you can try. Also, just learning and practicing new supports, new strategies to cope with negative feelings, such as participating in a virtual therapy or counseling group or support group. And you can find a variety of these kinds of things online. Also, be sure to set limits, allow time for decompression from work, especially for parents. Oftentimes, when you walk in the door from work or you're finished working for the day, times parents may feel obligated to immediately respond to the family's needs or questions or demands. And it's really okay to take time for yourself. Just take a few minutes to unwind before answering questions. And by you setting boundaries and taking care of yourself, you're setting a good example for your children too on how to take care of themselves.
That's a great point, Tammy. Thank you. Some things that fill our cup: satisfaction with our job, deep, satisfying relationships with family, friends, and having a few good friends at work, hobbies and interests, a sense of meaning in our life, positive thoughts and positive outlook on life, taking care of ourselves, and committing to personal growth and development. Some things that empty our cup: negative thoughts, feelings, and experiences, unrecognized or untreated mental health issues, feeling overly committed and pulled in too many directions, having limited finances and resources, poor eating habits, not getting enough restful sleep, and feeling like you're taken for granted. This visual here shows that you can't pour from an empty cup. So it's very important that you're doing those things that do fill your cup so that you have energy and patience to give to your loved ones.
I have a few coping strategies I want to recommend. And the first is just to remind yourself of two things. When you're in situations where you may feel put upon, you feel that people are coming to you to expect you to solve all their problems, or they're angry or upset or frustrated, and you're on the receiving end of that. We had a parent describe herself as the enemy, to her daughter saw her as the enemy, even though she was trying a lot to help her daughter. And so one thing to do is to remember the cotton swab Q-tip. Q-tip is quit taking it personally. Remember, sometimes it's about the other person. You might want to listen, be of help, but don't feel like it's about you or that you have to solve all their problems. Stay, and this is a cool stop sign with the word stay. Stop thinking it's about you. And that's another way to remind yourself, sometimes it's just not about us, it's about the other person getting things off of their chest, maybe targeting us. If it is about us and our relationships, we can work through that. But A lot of life experiences and life's interactions are really about the individual who's expressing their discontent or their feelings. It's important for us to also check in with ourselves. There's a really cool acronym, HALT, H-A-L-T, is to ask yourself, am I hungry? Am I feeling angry? Am I lonely? Am I feeling tired? What's going on with me? But by using an acronym such as HALT, it can help us to sort of check in and see what we need to do for ourselves. So we may need to take a break and have a bite to eat, or rest for a few minutes, or just talk to somebody about how we're feeling. And coping strategies are really important for how you think about life. Sometimes we need to reframe our thinking. For example, you see this kind of tattered frame here. And when you look through a framework like that into life, what we're looking at is what's wrong with the situation. So an example might be someone who complains, and we've all probably heard this, and maybe some of us have said it too, that the COVID-19 shutdown is just making me so miserable. I can't do what I want. I can't go where I want, or I can't see my family and friends. And it's just such an imposition, and it's unfair. Then I've included a really positive framework. And this is to change that thinking into what's right with the situation. For example, I am grateful to have a warm, safe place to live. I have good food to eat. It's good, nourishing food. I'm healthy, and I know how to protect myself from the COVID-19 virus or from any other illness. I have family, and we love each other. I have friends, and we care about each other. We are all in this together. So even if I don't get to see my family or friends in person, we do have the benefit of electronics where we can see them virtually.
So let's think of an instance when you were trying to get something accomplished. It could be a work-related task, a chore within the home, trying to fit in some time for exercise, but your children needed your attention or your workspace. Take a moment to think, how did you react at the time? Now that you have your reaction in mind, think about one coping strategy that you could have used. So for example, planning ahead is a great coping strategy, determining in advance which designated space each person will be using to work and to study, and even packing snacks and lunch the night beforehand can be a great strategy for mitigating interruptions the following day. I know I've been in situations where I'm trying to get something accomplished and my kids knock on my door, Mom, I'm hungry for lunch. So having those lunch boxes packed the night beforehand and letting the kids know when they're hungry and ready for lunch, they can take that out and they can have their PB&J, juice box, whatever you have in there. That's a great way of planning ahead for the next day.
Thomas Edison had a really terrific outlook, and I included this because I want to remind all of us that when we try things for the first time or for the first many times, we're new at it, it's not a failure. It may be just the way that doesn't actually work. But stay the course, continue to try new things, continue to commit to your health and well-being, and eventually you find ways that work. There's an American motivational author, Louise Hay, who says it so well. She has a number of wonderful quotes, and I included a few that I think are really applicable to this topic and are things that we can always keep in mind. So remember, you've been criticizing yourself for years and it hasn't worked. Try approving of yourself and see what happens. Think thoughts that make you happy. Do things that make you feel good. Be with people who make you feel good. Eat the things that make your body feel good and go at a pace that makes you feel good. And one that I think is really powerful is that if we can use our problems and illnesses as opportunities to think about how we can change our lives, we have power. Remember, you have to take care of yourself before you're able to take care of others. And again, just when I started off the presentation, I remembered, again, thinking about self-care as initially as something that was selfish. And that was when I was much, much younger. But after living life and realizing that when the oxygen tanks or when the oxygen masks drop in airplanes, putting yours on first gives you the oxygenation you need and the revitalization you need to take care of others.
These are some references that we use in building this presentation. So if you're interested in learning more about self-care and coping skills, we encourage you to look into these references here. And just thank you so much for attending our session. We welcome your thoughts and feedback. We hope that you enjoyed the session today and that you learned a few things that you can go ahead and do to take care of your own self and increase your coping skills.
Thank you very much. This has been a real pleasure, and we hope that you've benefited from some of the things that we've had to offer today. Take care and take care of yourselves.